good. All right. Well, hello, everyone. Good morning. So I'm a first-year PhD student in the Department of Social Welfare here at UCLA. You all heard the title before, so just giving a little bit of background. Many of you may know that gay, social, and sexual venues hold important cultural value for gay, bisexual, and other men who have sex with men, who I refer to throughout the presentation as GBMSM. And they've also been important targets for HIV prevention engagement. So, here in Los Angeles, we have West Hollywood, and, there's HIV testing trucks that also provide condoms and lube. Throughout the pandemic, they've faced operational restrictions, and some have faced permanent closure. So thinking about how GBMSM's behavior has changed throughout the pandemic, one study from April to May of 2020 found that 9 out of 10 men reported either having one or no sexual partners in the past month. And so for this study, it's a little bit later on in 2020. So we can see how there might be some differences there. And also other ways of that GBMSM have continued to engage throughout the pandemic has been through gay geosocial networking apps like Correlates, Grindr, etc. So the two aims of this particular study were to examine the impact of COVID-19 on GBMSM's comfort attending social and sexual venues, and also exploring correlates of sexual contact throughout the pandemic. So for this particular study, we recruited people who use Tornet, which is a gay geosocial networking app with over 25 million users globally. Our participants were 18 and over and provided informed consent, and the recruitment period for this study was from October to November of 2020. And the criteria for this analysis was cisgender men, which gave 15,499 participants in our sample with representation from 134 countries. Just giving some basic demographics of these participants. So the vast majority, about 95%, self-identified as either gay or bisexual, with the remaining 5% dispersed between questioning, asexual, queer, or pansexual. In terms of where they resided at the time of being surveyed, almost 3/4 of the sample, 70%, lived in either a large or capital city, while the other 30% were in these smaller geographic areas. And then the average age for our sample was 35. We also asked participants, since the COVID-19 crisis began, have you had physical sexual contact with a sexual partner that you met on a gay social networking app like Hornet, Grindr, etc.? And the majority, almost 65%, had the sexual contact, with the mean number in the past month of sexual partners being 2.42. And also we asked participants whether they'd been spending more time on gay social networking apps since the beginning of the pandemic. Here you can see that a pretty sizable portion, 38%, had spent more time, about 45% was about the same, and the smaller proportion spending less time on gay social networking apps. Related to the sort of different HIV prevention components, when participants were last tested, about 35% had gotten a recent HIV test in the last 3 months, 23% between that 3 to 6 month period, 15, 6 to 12 months, and then about 1/4 of the sample had been over a year. We also asked participants if they've ever taken PrEP, and here you can see that the majority as well, 87%, had never been on PrEP. With the remaining 13% of those who had taken PrEP, many still remained on it. So taking this sort of subsample, it's 65% of those were still taking it who had ever been on PrEP, whereas 11% were no longer taking due to COVID. And then there were those who stopped taking it due to other reasons, and those who had stopped taking it because they contracted HIV. And then at the bottom, thinking about other HIV prevention strategies throughout the pandemic, 12% reported having no or less access to condoms during the COVID-19 crisis. All right, so this next slide, so here there's 2 different bar charts that I broke down between those who had sexual contact and those who didn't, and how COVID testing looked like. So here you can see that both for COVID testing and having a positive test result, those who, compared to those who didn't have a COVID test, those who did were more likely to have sexual contact, as well as those who tested, relative to those who tested negative, those who tested positive were more likely to have sexual contact. And both of these were adjusted models for age and socioeconomic status. looking at COVID-19 precautions that were taken when meeting sex partners. So here, the largest proportions you can see at the bottom, the 24 and 23% were asking partners about COVID-19 symptoms, asking partners about their test status. The first one there, 20% restricting contact to same-sex sexual partners only, and then showering before and afterhand were the larger precautions here. And sort of the last portion of these results is we asked participants when they felt comfortable going to a bar. So again, this was between October and November of 2020. And here you can see those who had sex, reported having sex since the COVID-19 pandemic started. 45% felt comfortable attending now, and the percentages were a little bit less for waiting until feeling comfortable until public health officials indicated it's safe, once there was a vaccine or once their friends started going. And it was kind of the opposite for those who didn't have sex, where they would feel more comfortable, the largest proportion being there once public health officials indicated it's safe, once there was a vaccine, and the smallest felt comfortable going now. And for the two next slides as well, you'll see that the trends are similar, with there being little difference between feeling comfortable once their friends start going. So here's feeling comfortable going to saunas or sex clubs, and the second, feeling comfortable going to a private sex party. And here I now have the logistic regressions that I ran for using the referent category as those who felt comfortable attending now. And here, across the board, you can see that there was a statistically significant difference in those who felt once public health officials indicated safe, there was a vaccine, or once their friends started going, were less likely to initiate sex. So again, these being controlled for age and socioeconomic status. The only one that changed in significance was for the saunas. Once my friends start going, that was only marginally significant. So from the data that I presented today, you can see that sexual partnerships have continued among gay and bisexual men throughout the pandemic, with over 65% having had physical sexual contact with their partner, with a partner throughout since the beginning of the pandemic. And those who felt comfortable attending social sexual venues, getting a COVID test, and testing positive were more likely to have sexual contact. So thinking about where to go from here, I think this data really highlights that there's a need for ongoing attention to HIV prevention focused on gay, social, and sexual venues. And just as Gary mentioned during the keynote, thinking about the creation of other safe spaces for community and other opportunities for them to engage with one another for their own well-being. There's also, I think, thinking about the larger consequences of the pandemic and which populations were disproportionately impacted, knowing that, there's been now more recent research published with those living with HIV, racial and ethnic minorities, immigrants, sex workers, and those socioeconomic and economically disadvantaged groups being more disproportionately impacted. And knowing that geosocial networking apps are an opportunity that the community has continued to engage, really being able to leverage those resources, not only for HIV prevention engagement, but also then connecting folks with COVID-19 vaccination and testing information, really having this holistic health approach, and considering not just their sexual health for their well-being. And finally, tailoring messaging to foster trust between GPMSM and public health officials. And in terms of also where I see this data going, working on developing this into a brief report to be submitted for publication. And I'm also going to look at differences in the comfort attending sexual venues between countries where same-sex behaviors are criminalized versus those that are not. Since I believe about 40 countries within the 134 that were captured for the study had same-sex criminalization laws. Getting into some of the limitations. So participants here were recruited only from one app, Hornet, so that pretty limits our generalizability of the sample. This was also all self-reported data. So some people may not have felt comfortable endorsing that they've been having sex prior to vaccination, and public health officials indicating that it's safe to do so. And also just acknowledging that there's been a big shift in the pandemic since October and November of 2020. The implications for this study can be applied a little bit differently now. So I just want to acknowledge my advisor here at UCLA, Dr. Ian Holloway, Cheng Lin, who's also a doctoral student in the Department of Social Welfare here, Alex Gardner at Impact Global Action, Sean Howell at Hornet, and of course all the participants who took part in this study. And here's ways to stay engaged with the UCLA HIP.
Thank you, Juan. Great presentation.
Thank you.
So let's see, I don't think. So there was can you see the chat?
Yes. So those who tested positive, yes, that was positive for COVID. So on the left, there was, I can try to share my screen and go back to the slide real quickly. So here on the right is having a positive test result for COVID versus a negative result. And did you collect what apps were used to meet the partner? Right. So for this particular, the questions that we asked, we didn't ask about other apps that they were using, but everyone that was in the study was a Hornet user. So there was at least that one. I think it really varies by country as well, even by city here in the US, which apps tend to be the most popular. You know, there's Scruff, Grindr, etc. But we didn't get more of that information. And with about 79% men only engaging in same-sex sexual partners, what are your thoughts on the rates of new PrEP uptake? I think for this one, the rate for the PrEP, it was a bit, unfortunately, we didn't ask more questions related to, facilitators and barriers to PrEP. I think, here I didn't want to say, obviously, that we would want everyone to be on PrEP who took part in the study. It's just those who, thinking about what accessibility looks like for those who do want to, who are engaging in sexual risk behaviors and want to better ensure their sexual safety.
Right, I don't see any other question. So I guess my question for you is like, what was the biggest surprise to you?
So for me, something that was sort of, and I see some other questions coming in, but one of the things that was most surprising to me was sort of how many individuals, especially just prior studies, again, that study from May about how 9 in 10 had not had any sexual contact or just had one partner, versus here there's a much larger percentage. So I just seeing the shift in people's sexual practices even prior to vaccination was one of the things that I found interesting. And one of the questions, what are your thoughts on the higher likelihood of those who test positive having physical sexual contact after the positive test? Suspect that those people might feel safer connecting for sex in person after they have antibodies from natural immunity. And how do you think that would relate to immunity through vaccine and boosters? I think for the first parts of the question, those who tested positive, it's not clear whether they were still having sexual contact after having received their test result. But I think we see even now that people are feel more comfortable going out if they have already contracted COVID, especially with this newer wave, and that does sort of give people their own security. I mean, now there's also the vaccines, and the severity of symptoms isn't what it was back in 2020 before there were more people vaccinated. How that's related to immunity, I don't think I can speak to that in particular. Being willing to ask for, was there a graph between willing to ask for HIV status versus COVID status? No, there was not, unfortunately. I think that would have been a really interesting comparison to make, and how comfortable people were in navigating those conversations. But I do not have that. And what tactics did you use to get people to participate in the study? So all of these folks, again, were recruited through Hornet, so it was advertising through the app. Was I able to see regional differences in access to COVID-19 testing? That's actually one of the analyses that I really wanted to do, but given the large scope of the sample and just how much access to testing varied, even here in the US, between county, between city, between neighborhoods, I think it really made it impossible to parse that out a bit more. Although it could have been very informative if it was more, if access was more consistent and dispersed evenly.
Juan,
Right.
oh, I just wanted to say thank you so much. I wish we had so much more time to talk to you because I loved your presentation, and I know we're hearing that in the chat too. I do think we have to move on to our next speaker just for time. So Ron, do you want to go ahead and introduce?
Sure. So our next presenter is Martin Santian. He's a research assistant at Bienestar Human Services and a senior at USC. And Warren, are you ready and have your slides up?
Yes. Can everyone see them?
Yes.
Awesome. So thank you guys so much for being here. Juan, that was a great presentation. So today I'll be presenting using PrEP as part of a larger movement and additional individual and community level benefits of PrEP use among Latino, gay, and bisexual men. And so these findings were in collaboration with my fellow research team, Omar Nieto and Dr. Brooks. So I'd also like to give them a huge thanks before we begin. And so background and objectives. To begin, HIV infections disproportionately impact Latino, gay, and bisexual men in the United States. So
switch your slide.
What was that?
You want to switch your slide?
Oh, did it not switch? Sorry.
No, it's still on the title page.
Can you see it?
It's still the title slide.
Oh, love. Let's see. Is this
There you go.
Yeah. Awesome. So good.
You're good to go.
Okay. So to begin, for instance, the CDC estimates that 1 in 5 Latino, gay, bisexual men are projected to contract HIV in their lifetime compared to 1 in 11 white, gay, bisexual males. That's just one of the many staggering statistics. And unfortunately, Latino, gay, bisexual men in LA County mirror the national trends as well. And so, in fact, they comprise the largest percentage of all new HIV infections. So to counter these high rates, we look to PrEP, which is a highly effective HIV prevention strategy. Unfortunately, we also see suboptimal rates of adoption, PrEP discontinuation, and persistence. In 2019, the CDC reported that only 14% of eligible Latinos were prescribed PrEP compared to 63% of white persons. So basically, unless there's a reversal in these high numbers, high rates of HIV incidence will continue to rise. All right, is my screen still viewable?
Yes, it is.
Awesome. So basically, for this reversal to occur, we'll need to look at more approaches beyond the biomedical focus. Fortunately, several studies have outlined and examined added benefits.
You didn't switch the slide. It's still this background.
Oh, okay. Let's see.
There you go.
Okay. Let me know if it continues. So basically, fortunately, several studies have outlined and examined added benefits of gay bisexual men who use PrEP beyond the HIV prevention. But It's also important to explore if these are present among Latino, gay, bisexual men users as well, and highlight any other unique benefits that might be present. So this is what this study contributes to the literature. So we're extending our focus beyond the biomedical view, and we also are considering the individual in relation to his surroundings and community. All right, so methods. I hope methods are present. And so
I'll let you know if you didn't switch.
all right, thank you. Between January 2017 and October 2017, a sample of Latino, gay, bisexual men PrEP users were recruited through sexual and social networking apps, so like Grindr and Growler, community events, and community agency of referrals via Bienestar to complete an in-person semi-structured interview. Individuals were eligible to participate if they were 18 years or older, identified as Latino, had sex with another male in the past 6 months, and were currently using PrEP and residing in LA County. Data were analyzed using an inductive, experiential, essentialist thematic analysis approach. And so now we can move on to the demographics. All right, so here's a table of the demographic and PrEP use characteristic. As you can see, we had a sample size of 29 participants. In this table, we can view socio-demographic and PrEP use as mentioned. So the average age was 30 years, with the oldest being 49 and the youngest being 21. The majority identified as gay, 86.2% specifically, and reported at least some college experience with almost 90%. 79.2% reported having an annual household income of $40,000 or less. The average length of PrEP use was 17 months. The median was 12, with a range of 0.25 months and 68 months. And lastly, 3/4, so about like 75%, self-reported very good or excellent PrEP adherence. All right, so to our results. All right, 5 things were constructed based on our results, based on the interviews. I'll go over each individually, as I'll be examining them with an exemplary quote from our participants. All names included are pseudonyms. And now we can continue. So this is the first result. Let's see. Reduced fear, anxiety, and stress about HIV, HIV testing, and sex. So in this first quote, we have the threat of HIV portrayed as a dark cloud looming over a young boy's gay life. And with PrEP, that fear/anxiety is gone, according to Enrique. Additionally, another participant compares it to a weight off his shoulders, which participants noted not only during and after sex, but also in regards to testing. All right, another result that we found was feeling empowered and in control of their HIV risk. One says, I feel more open with myself. I feel more open with my doctor. I feel like I'm taking agency over my health. This sense of empowerment doesn't just bleed into people's sense of self and feeling less fearful, which in itself is a great thing, but we also see that it impacts the relationship with medical professionals. Further, in his message to other guys in the second quote from Antonio, he relates PrEP with not worrying about HIV, and further quote, being engaged in healthcare is going to keep me healthy. So hence this empowerment and taking control of their sex lives from our participants invigorated them to become more active in their health. All right, and our next is greater awareness of sexual risk behaviors and sexual health. In short, these participants' PrEP use promotes other positive health benefits, such as greater awareness. In the first quote, Edgar recounts that he now gets STD tested much more often than he previously would. He would only get tested once or twice a year. So he relates his PrEP use with greater consciousness. Further, in the second quote, one participant reveals, I'm a little more relaxed with using condoms and I'm trying to get better at that, but definitely knowing I'm on it almost feels like an additional defense that I can afford because I'm using PrEP. So here he's aware that he should be using condoms, which obviously are super important, but also he recognizes the protection/comfort that PrEP provides him. And in our interviews, many other men also revealed similar sentiments that PrEP can allow them to perhaps have condomless sex without using PrEP. which they otherwise wouldn't have done, or they would have felt restricted in some shape, way, or form. So here we touch upon the pleasure that PrEP provides the ground for, which leads us to our next. Greater sexual exploration and pleasure and comfort having condomless sex. So we can look at the first quote by Antonio again, and he says, "I love using it. It's a great tool. It allows me to have the sex life that I want and not stress too much about it." So this quote pretty much sums it up. Many of our participants cited several specifics, such as being more adventurous, being able to have bareback sex, having more fun, feeling happier, feeling at ease. And so all coupled with being careful and being responsible because of their PrEP use. So in this light, participants, as mentioned in the first quote, can finally have a sex life that they want, regardless of what it may look like, condom or no condom, top or bottom. They feel a sense of agency leading to pleasure with their PrEP use. And in the second quote, Enrique explains feeling sexually liberated and talks about feeling like he will never be able to do the things he can do with PrEP, acknowledging the height of the HIV/AIDS epidemic in the 80s and 90s. And so our last quote is a greater connection to the gay community and a feeling of contributing to the elimination of HIV. So this sentiment of the HIV/AIDS epidemic, it doesn't fall short on our participants. Rather, many of them, such as in the first quote, express relief and gratitude from the prevention that PrEP provides them with. It's a step forward to an AIDS-free generation. The second quote highlights this pleasure from perhaps benefiting the entire gay community and being a larger movement. He continues, "By me being on PrEP and spreading the word of PrEP and spreading the message of how beneficial PrEP is and encouraging others to get on it, that hopefully they do the same and that this could be some sort of larger effect where we are now more protected as a community." So contributing to end this disease to our participants is regarded as some greater movement. And like all movements, it involves everyone mobilizing action and encouraging others and ultimately uplifting each other. And so this leads us to our discussion. These benefits, these added benefits identified represent a range of social, emotional, and psychological benefits that Latino gay bisexual men experience while using PrEP. Overall, this helps improve the quality of life more than the sexual lives of Latino gay bisexual men, but also their social lives. PrEP is helping say goodbye to that dark cloud, the threat of HIV that looms among these men's lives. And ultimately, the benefit that we identified among PrEP users, Latino PrEP users, not noted in other research, was that greater connection to the gay community. They spoke of a camaraderie they had with other PrEP users and how being part of this community of using PrEP compelled them to actively spread PrEP information to peers or in their community social network in the hopes of increasing uptake. So in this sense, they're serving as PrEP champions. And even in the case of PrEP, reminiscent of Latino culture, the individual is subordinate to the group. No, the we supersedes the I, the individual. All right, future directions. Beyond prevention, PrEP generates other collateral benefits of promise to Latino gay bisexual men. So these benefits can help inform the development of future PrEP messaging to help fortify and incentivize motivation for PrEP uptake and persistent use among Latino gay bisexual men. And so increasing adherence and persistence use can be improved by further incorporating them in the process. We have demonstrated that they want to help their own community. These participants, they're PrEP champions, and we can use that knowledge to help address barriers or concerns to initiation and retention and care. And this can be especially helpful with the future release of injectable PrEP. And lastly, further research should be conducted, whether if this is the case for other cultural groups as well, this feeling of community connectedness. And lastly, limitations. Our sample was recruited in Los Angeles County, and as we all know, there's a large Latino population here. So it might not reflect the experiences of Latino gay bisexual PrEP users in other settings. where the Latino population isn't that high and that feeling of community might not be present. And additionally, the sample consists exclusively of English-speaking Latino gay bisexual men, and so it may not reflect the experiences of Spanish-speaking Latino gay bisexual men, PrEP users in LA County. So research with monolingual Spanish-speaking Latino GBM is definitely needed to access if positive experiences and benefits gated from PrEP use differ based on language and other cultural nuances not really highlighted here. And lastly, I would like to thank everyone. I'd like to thank our participants, especially in addition to Omar Nieto, Dr. Brooks, and Bienestar.
Great, thank you, Martin.